Uh, uh, Dr. Sanjay Mehta, you can start.
Okay, sir. Good evening, all friends. Once again, welcome to our webinar series. Today, we'll discuss about case-based learning, right? But before we start, I would like to show you the work which is in progress. That is our competency and SLO making, right? Various systems. I appreciate the effort of all the leaders, right? And I see there are much improved one, but still there are certain which needs to improve. As for example, this one, cardiovascular system, there has been quite good improvement in this musculoskeletal. CNS is also okay, good enough. Respiratory system, yes, okay, good enough. GU, okay, good. Zoonosis 1, okay, over here still needs to be refined. And zoonosis 2, okay, once again name of the session needs to be assigned. Now before we start, why it is important, let me show you the timetable which is going to be prepared. All right, as we all know, the NEET has been extended to a September, and now we don't know whether the students would be able to join by October, right? So we don't know, but still MCI is not in his workshop. They have not conveyed the last date of timetable upload. But this is what we are going to prepare. You can see over here in this timetable, blue in color is microbiology. Green in color is pharmacology. The brown in color is PSM. And this is how you can see the structure and function of immune system. This is what week wise we have prepared. It is starting from, you can see, the 1st October, and the first lecture is of microbiology. That is introduction to microbiology. Over here you can see on Monday 6th of October there is a lecture, that is immunity, right? And now if we go to the details of that, you will be able to connect that, right? Over here you can see this is immunity, right? So this is what I wanted to name the session, right? It is very difficult that you copy this entire competency in this timetable. It will not be feasible, it will not be possible. And problem is that in some of the subjects, this one competency can have more than one sessions. Over here in this particular competency, you can see there are several sessions, right? So one session, one of the competency, this is the one session, that is immunity lecture, and this is being reflected over here, right? Immunity lecture, but the competence you can see 1.7, it has been described, right? Now if you go further, you will find the same thing which will continue, structure and function of immune system, right? MI 1.7. Now you can see this is another session. This is lecture, structure and function of immune system. What I am supposed to take is being narrated over here. These are SLOs, right? So in timetable, we'll not be putting competency and we'll not be putting objectives, but this is the name of that session. Earlier that we used to put the name of a topic. The same thing, this session indicates over here the structure and function of immune system. That session would be lecture, and naturally lecture would be of 1 hour, 12 to 1, right? So this is how we are going to prepare our timetable. If you see, there is another session, virus laboratory diagnosis. If you go upside, okay, upper one, microbial world, right? This is a demonstration. It will be at 2 hours, 3 to 5. And if you go to general microbiology, this is immunology, general microbiology, you will find this microbial world, right? What they are supposed to do in that. Okay, so this is how we are going to put in our timetable. So very similarly, you can see all things basics microscopy. This would be a lecture 12 to 1 where we'll be taking a lecture on PowerPoint explaining the fundamentals of microscopy, and over here a DOP session is being conducted about microscopy. So this is how we are going to put that. You can see competency MI 1.2, and you will be able to identify the same thing, right? MI 1.2. Over here you can see microscopy DOP, what we are supposed to do in that. Microscopy, gram stain, Zn stain, each session is separately coming in one particular session. Either it is lecture or it is practical. So once again, I am reiterating the same thing, that when we prepare timetable, this timetable will be like this: 12 to 1 immunity lecture into bracket MI 1.7. MI 1.7 is competency, mode is lecture, and what topic we are going to cover is immunity. That will be this one, right? Over here, if you see immunity, and in that lecture, what I am going to cover, it is very well described over here. These are our objectives of the particular session. Okay, so that is why I was saying over here, if you see, it becomes very difficult. SLOs are there, but we have to name that SLO, right? We'll not be able to put this session, this particular session, because this is too long. It may be simple as, for example, zoonosis, right? And if you are going to take more than 2, then this is zoonosis small group discussion, or this may be a zoonosis lecture, like that. But you have to name this, what we are going to talk in this particular session. This may or may not be zoonosis. I am just giving example. This is zoonosis as for example, right? So thing is that you can see this is not able to, we are not able to put it in our timetable, right? So that is the naming which we are supposed to do. I think I am very clear with regards to this. Dr. Prakash, can you just unmute yourself and Dr. Prakash? Yourself.
Hello, sir. Yes, sir.
Yes,
Yes, sir.
yes. Am I
Please
very
tell me, sir.
I think, yeah, I am very clear, right? This is what we are
Yes,
supposed to
yes.
do. When we prepare our timetable, it will be very difficult to put all competency and SLOs. We will have to name it. Right?
Yes, sir. Only the competency number can be put in that.
Yes. Okay. Thank you. Okay. After that, now, I think one of the session which was conducted by Dr. Ritu, teaching learning methods. So, in extension to that, one of the most important is case-based learning, which will come our in most of the sessions, right? So we are going to spend some time in understanding what is case-based learning and how it can be used for competency-based medical education. I'm not going to talk much in theory, but some introductory part, and I will switch on to the microbiology aspect, right? So over here, the first thing is that if you see over here, the goal of case-based learning is to prepare students for clinical practice through the use of authentic clinical cases. It links theory to practice through the application of knowledge to the cases using inquiry-based learning methods. This is the standard definition as far as the textbooks and the case their references are concerned. But the important point over here is that we are preparing our student for a clinical practice, and that clinical practice is of Indian medical graduate and not a microbiologist. But it is important that they understand the use, the utility and application of clinical microbiology as being a medical graduate. MBBS graduate. Remember that. So the first thing which will come, we must have heard about problem-based learning and case-based learning. So what is that? See, basically, they are very related. The problem-based learning came into medical education before case-based learning, and case-based learning is an improvement over problem-based learning. Now, you can say the goal of problem-based learning is problem solving. One case is identified and is assigned to the student, and then the solution of that problem is to be sought by that particular student or a group of students, while the focus is on problem solving. In case of a case-based learning, the focus is not the problem solving, but focus is about the clinical case. What is happening to clinical case? What is the diagnosis? What is the investigation? What are the management modalities? That is more important. You can see over here, advanced study, when students are given minimum resources and direction with regards to problem-based learning. So when they come in a class, it is totally new, almost new, except some few important topics, a few important information is being gathered or given. While in case-based learning, the full details are explored. It is already being communicated with students. So students, when they come to the class for case-based learning, they are thoroughly prepared. The learner's role in problem-based learning, the students are active. In case-based learning also, students are active. But the learners are not prepared in case of problem-based learning, while in case-based learning, learners are very well prepared. Prepared means with regards to a particular case, right? In PBL, it always like a surprise, while in CBL, it is already they know everything about it. The role of a teacher in problem-based learning is almost passive, right? They do not guide much. While in case of a case-based learning, the teacher would be there and would be guiding them. So it will be a mixture of both things. The students are active, students are getting direction, students are also suggesting some direction. The teacher is also active and is also giving direction. The case is usually one. The group of students work on the solution and they come to a solution, and that is the end of problem-based learning session. While in case of a PBL, it may be a single case or it may be a multiple case, right? The students would come together, but they already know the topic. They know which type of case is there. They are prepared for that. And then they further identify some more information. At the end of that, they may be given another case, which may be in advance or having a complications of that. So maybe a single case or multiple, usually multiple cases are given in case-based learning. In problem-based learning, objectives are very loose. That means no predefined objectives are framed because everything happening once the case is disclosed. And that is why we see that it is very important that how students identify what is the problem and how to solve it. That is the main focus in problem-based learning. So what is coming is always a surprise, right? And they identify several things while going through this process, and at the end they acquire new knowledge. While in case of case-based learning, the objectives are very discrete, they are predefined, and they are supposed to be met at the end of case-based learning. Over here in problem-based learning, the outcome is the process, the solution of the problem, and once the problem is solved, the case is over, the session is over. While in case of a case-based learning, the outcome will happen when objectives are achieved, which are predefined in nature. So this is in brief the contrast between the problem-based learning and case-based learning. If you see this figure, it will give some idea that what is happening. The topic, the first one is the topic, initial topic. You can see the student, what is happening to student? In PBL, the students are unknown, while in case-based learning, general contents are disclosed to the student. The faculty, you can see faculty is fully aware. A full case disclosure, they know everything, both in case of problem-based learning and case-based learning. So faculties are prepared when problem-based learning and case-based learning session starts. Students are not prepared. They are unknown in case of PBL, but in case of CBL, they know much about the case. The second is preparation. You can see no advanced preparation for problem-based learning. But in case of case-based learning, you can see there is almost lots of preparation because they know the case and they read a lot and they are very much prepared. The faculty in both PBL and CBL, they know they are fully prepared. The control of a session, you can see case-based learning, it is midway. Teacher is providing the guidance. While in case of problem-based learning, you can see usually the students are in full control, right? Direct discussion is happening among the students. While in control, you can see case-based learning, teacher and student both are controlling the session, right? While in, you can see in problem-based learning, teacher is not in control. So whatever happening is happening independently in case of problem-based learning. While case-based learning is guided learning. So teacher and student both are taking part and teacher ensures that objectives are achieved. Whenever they feel that something is going out of the way, they bring back the discussion and talk to the line. Data seeking, what is happening, you can see case-based learning, many of the information was already searched for. So only remaining part of information is sought during the session. While in case, because problem-based learning, when the session was started, it was not having that much of information. So lots of information is being sought during the session. Faculty, case-based learning, because everything is so much prepared, so hardly there is any additional data is being sought in faculty. While problem-based learning, because this is an independent, it may come up with new information. So we can see over here, it is very clear that problem-based learning starts, the students are not aware about the thing much, the teachers are teachers are fully prepared. Then in problem-based learning, when discussion starts, the most of the control is with the students who are totally not prepared, but they sought a lot of information while conducting the session, while teacher is not guiding that much. In case of case-based learning, the students know many things, teachers know everything. There is a lot of preparation by the student, but teacher is also fully prepared. When the session is overgoing, both of them are in control, the students as well as teachers. The information and data seeking which is happening, many of the things they know and some of the things they identify. So this is the fundamental difference between problem-based learning and case-based learning. Okay, now when we talk about that, there are several methods. You can see over here this method, but we should understand that the case can be integrated within the lecture. So you can see the lecture-based case presented in confines of a lecture. Another method is case-based lecture, that cases are used as adjunct to lecture. So you take a lecture and in end session or in session which is following the lecture, you give them a case to reinforce the knowledge with regards to the particular clinical topic. Case method is another method in which we only talk about the clinical case and we teach them by that only without taking any other type of sessions, right? So these three things are very important. We are right now not discussing the rest of the method, but you can see over here how it can be done. So lecture, and within the lecture, a case is being integrated. So you talk about when you start your lecture of enteric fever, you start with a clinical case. So you try to make it interesting, right? You try to make it more of a clinical rather than going for an organism. You go for a clinical case, and then you discuss about various manifestation, and then you discuss about laboratory diagnosis. This will be a part of your lecture. Another method it can be, you take a lecture of enteric fever, rather enteric fever, and then followed by one clinical case separate, right? Another session where you can go for a small group learning to reinforce. If the topic is very important like tuberculosis, you should follow like that. Take a lecture followed by 2 hours of session of small group learning in which you go for case-based learning. If you feel the topic is not that much important like anthrax, you simply put that case within the lecture and complete that. You don't go for small group discussion. Then paper case can be used in addition to our lecture. That is what we are talking, lecture plus case. When lecture integrated case, then lecture followed by a small group discussion in which paper case is given. Then another method, case simulation. Over here it is not a paper case, but it is a simulation where we can use either volunteers to show some clinical sign and symptoms, and that can be discussed. Then total clinical case is based on computer or web and is being assigned to the student. The best would be to have a real case along with either book manual or computer or web case, and the best out of all is real case. But usually second MBBS microbiology, it would be difficult to teach them on a real case. So the modalities of case-based learning depends upon feasibility and authenticity. If you look at this, the authenticity is highest in real cases, but the feasibility is lowest. So we'll have to identify based on our feasibility and authenticity, because case-based learning, the authenticity is most important aspect, but feasibility is also a very important aspect, whether we are be able to do that. Gas gangrene or some important case that we do not see very regularly, you have to prepare a paper case. Or some of the other things, if simulation is available, we can do that. If real case is available, then you can use that, but there are a lot of problems with the real case, and especially if we are in microbiology, right? So this is how it can be integrated in our timetable. Now we'll discuss some of the cases of case-based learning. It can be a very simple where multiple cases can be covered in one lecture, or it can be a single one. We'll show few examples of that. You can see over here case 1, the clinical history. Over the course of 1 week, a 6-year-old boy develops 0.5 to 1 centimeter pustule on his face. During the next 2 days, some of the pustule break, forming shallow erosion covered by honey-colored crust. New lesions then form around the crust. The boy's 40-year-old uncle developed similar lesions after visiting for 1 week during the child's illness. The laboratory finding on a gram stain, a swab taken from the lesion and gram stain shows gram-positive cocci. Gram stain from the culture plate shows gram-positive cocci in cluster. Over here, you can see if you are taking a case-based learning, you reveal this first part, and then they will study that thing and they'll come prepared. And during this session, you can ask them what they want, and gradually, one by one thing, you can go on revealing, right? So it will be a direct discussion between the students and teacher, and the information you go on revealing, right? So if the students are asking, sir, what would be the picture of a gram stain? I would like to go for a gram stain. Then you can reveal, okay, the gram stain shows such type of picture. Then the students would either you can give it as a whole, or you can have a live discussion. Students go on asking you about the details and you go on revealing the case. If the question is like that, I would like to go for a culture, then you can reveal, okay, the culture on the blood agar shows a beta hemolysis and biochemical reaction shows it is catalase positive, coagulase positive, and the culture has shown the gram positive cocci in cluster, right? Then you can also ask them, or they can direct you that, sir, I would like to go for sensitivity testing. It looks like staphylococcus, and it is very important that antibiotic sensitivity is a very important thing, and especially methicillin sensitivity is very important, right? And if they forget, you can ask them a question. Would you like to go for a sensitivity testing with particular emphasis on one antibiotic, which may change the whole antibiotic therapy? So this is how you can guide them. Or if they come up with that, definitely we should lead them to methicillin sensitivity. So this is how you come up with that. And if you are going to have a very short time, you can reveal everything and you can ask questions, or you can ask questions in between also in a session. What is the most likely diagnosis, right? So this is a severe case of impetigo-bullosa. What is the most likely microorganism? Staphylococcus aureus. Over here, before ending the case, if the objectives are defined, we can discuss about what is the pathogenicity and how it can be diagnosed, summarized, and what is the importance of antibiotic resistance, right? So this is how the objectives has to be decided by the teacher before the case is being disclosed, right? The case is given to them along with the objective. So they would be able to understand everything and they will come fully prepared. Second session, another one, the case 2, the clinical history. This 29-year-old male's illness began 10 weeks prior to death with an episode of flu. 2 weeks later, his urine became smoky. He was found to have hematuria, albuminuria, and elevated BUN. He died from pulmonary embolus. You can see over here, the case would not come, right? It is almost autopsy, a dead patient. So we can definitely say that this will not be only microbiology, but there are two subjects involved. One would be microbiology, another would be pathology, right? Okay. Now, the blood culture, which was prescribed before, it shows such type of finding: blood agar, colonies with beta hemolysis, and gram chain with gram positive cocaine chain. Findings, autopsy findings, the pathology: the kidneys were enlarged, the surface was granular and covered with pinpoint hemorrhages in a fresh state. And these are the histopathological findings, which we are not going in detail, but you can definitely see over here that this is a combination of pathology and microbiology. So it becomes a linker between pathology and microbiology. Some of the part of this will be taught, or rather will be explained in a session in a pathology, and some of them in microbiology. Either it can be a two separate session, or it can be a combined one session, right? If it is combined one session, it would be a correlation where the objectives of pathology and microbiology would combine together, right? So you can see over here, these are only few exemplary questions, only few one, but it can have a big list of questions both from pathology and microbiology. But I'm just displaying microbiology aspect of that. So what is the best diagnosis at the time of death? Maybe a chronic glomerulonephritis. And what is the most likely organism? Streptococcus pyogenes. So over here, the objectives of pathology can be predefined, microbiology can be predefined with pathogenesis and complications and laboratory diagnosis. While in case of a pathology, it can be a gross and microscopic findings can be predefined. Remember that creating such type of case will be a great exercise, because we can create a case for microbiology, but to create a case for microbiology and pathology, we need to sit together. Okay, so we're going for another case, a clinical case. A 4-year-old female had a gradual onset of fever, productive cough, anorexia, diarrhea about 11 days prior to death. The breath sounds were harsh and few cracking ralls were heard over the right base posteriorly. Once again, there was a patient who is dead now, but there has been investigations which has been carried out before the death. Okay. Laboratory findings, the sputum smear showed acid-fast bacilli. We all know very well, right? This is a case of a tuberculosis. But this is how you have to ask if these are the clinical features, what would you like to go for? The first investigation, sputum smear microscopy and acid-fast bacilli present. Then lung, once again, gross pathology. Lung showed fibrinous exudate over pleural surfaces. The cut surface of the lung revealed innumerable small gray white nodules, 1 to 4 millimeter in size. A large caseous tubercle of 0.5 centimeter was present in the left lower lobe, eroding into large pulmonary vessel. So you can see it is not only microbiology, but it is also involving pathology. Once again, histopathology. HP examination reveals numerous poorly defined tubercles, caseous necrosis, mononuclear cells, epithelioid cells, and few giant cells which were noted. Remember that this all needs to be specified in objectives, right? The student should be able to describe and identify the histopathological finding in case of biopsy or in case of autopsy in tuberculosis, right? So they would be prepared and they would be very much ready to answer you each and everything. Then culture report, sputum culture result become available 4 weeks after that, showing presence of growing colonies. Once again, what is to be done? It can be asked that what will you do about that? Or student would suggest that I would like to go for identification of that one, which will ultimately turn out to be Mycobacterium tuberculosis. Now, another important thing, if your objectives are also that student should be able to describe the drug therapy for tuberculosis, anticox treatment, then this will become a linker for microbiology, pathology, and pharmacology. All three simultaneously, right? So all three subjects will have to define their objectives. They'll have to identify the questions which they are going to ask during the sessions. The students would be prepared accordingly. But this is a linker which will be linking all three subjects of second MBBS: microbiology, pathology, and pharmacology. In pharmacology, category 1 and category 2, they will take about in therapy of tuberculosis. So what is the likely causative agent and what is the clinical diagnosis, right? This is Mycobacterium tuberculosis and miliary tuberculosis. But over here, you can see it is not only this case, but during the discussion, we can discuss everything. What are the clinical features of tuberculosis? What can be the various pathology? What are the modes of diagnosis? Everything can be discussed in 2-hour session of case-based learning. And that you have to specify in your objectives before you give a clinical case. Clinical case is usually a simple one, but the objectives are exclusive of everything, right? So this is how objectives can be achieved. Remember, the clinical case is a stimulation, and achievement of this is not the end, which is in case of problem-based learning. Problem-based learning will start with the clinical case, and the moment they identify that this is tuberculosis, everything is over, right? It is taken for granted that they have learned everything about that. But in case-based learning, this is only a stimulation, but the achievement of objective is the end of case-based learning. Now, 2 more cases we'll discuss. Was Mary Mellon a symbol of threat to individual liberty or a necessary sacrifice to public health? You give them this particular case and give time to learn, because you have disclosed this. Usually what happens, case-based learning, we disclose them on Saturday evening. we assume that they will read at least 2 hours during Saturday and Sunday. And when Monday, the session will start, they are ready with everything. They know what is merimelon. They know what is typhoid. They know how typhoid is spread. They know what was the role of merimelon in generating the epidemic of enteric fever. They know what happened to merimelon, right? And what was the problem? Was merimelon was a problem, or the authority was a problem? Why ultimately you all know that merimelon was sent to Brother Island for the rest of her life, where she died. So over here, this case is not only about enteric fever, but this is about the attitude domain, right? Where they will be able to understand the problem, what is happening apart from enteric fever, that Mary Mellon was a threat to individual liberty and it should go to the jail or to be a total isolation. Yes, some of them will say, yes, it is very right that such type of people should be sent. And some will say, no, no, this is not right. This is a threat to our liberty, right? So it will generate a great, what we can say, they will come up with their own ideas and say both of them are right. It is not like that one group of students would be right and another is wrong, but at least they will understand that there is no right solution for such type of case, right? There are always two sides of a coin which they need to understand. There is nothing right and nothing wrong in ethics, right? One more case you can see over here. Over here, this is what we used to teach them in second MBBS. A 19-year-old male with no significant past history was admitted with fever, fatigue, anorexia, jaundice, and dark urine for 5 days duration. He denied alcohol intake, prior history of gallstone, diabetes, and dyslipidemia. He was fully conscious, and there was no hysterexis, right? So we are discussing some case about jaundice and dark color urine. And now, when this case is being given to them, the students would be able to identify important organism that they are supposed to read about. As for example, it will be of viral hepatitis, right, or something like that. Now, along with that, you also give the specific learning objectives, right? That what they are supposed to do. Propose a clinical diagnosis, list the common signs and symptoms, enlist the differential diagnosis, enlist the laboratory test, explain the interpretation of a report, laboratory report, explain pathogenesis and progression, enlist the additional investigations required, enlist the management protocol, enlist the health advice for patient, and explain preventive measures for stopping HPV transmission. So you remember that over here, student when come to your session would be fully prepared with viral hepatitis. Not only that, you will also read about the causes of jaundice, bacterial, viral, parasitic, and everything, and they are ready. So you discuss that thing in the first session, and then the session would end with another session, that is another complicated case, hepatitis or something different, right? Hepatitis B outbreak investigation report in Sabarkantha district, Gujarat state, February 2009. During the ongoing outbreak of hepatitis B in state of Gujarat as on April 11, 2009, total 93 confirmed cases had been registered with 94 deaths of unfortunate victims. It had been a major public health challenge as a significant number of deaths occurred for a short period in focal area of state. Now you can see the objectives which is there: infer the probable clinical diagnosis of the clinical case presented, enlist the investigations to be carried out, explain its interpretation to confirm the clinical diagnosis, and discuss the medical, legal, and ethical issues related with the case. So over here, you can see students is not only learning about hepatitis B epidemic, they will try to find out what happened there and what is to be done as an investigation for identifying the outbreak and what can be the problem. In this particular case, there was a FIR against a doctor, two doctors, and both of them have been sent to the jail, right? So they will understand the importance of that, because it was this doctors were reusing the disposable needles and syringes, and they cause a great havoc in the particular district. So you are teaching your student not only microbiology, but also several other important legal and ethical aspect of case-based particular disease and practice of medicine with this case-based learning. So with that few important examples I have explained with regards to microbiology, I'm ending this. The clinical case of number 1, 2, and 3 has been taken from Duke Medicine website. There are plenty of such type of website from which you can directly take such type of a clinical material and prepare your clinical case, either for solo in microbiology or with pathology and also micropatho and pharmacology. So with that, we end this particular session. I request all of you that also please attend one more session at 7 o'clock, which is very important, about the logbook. Logbook, as it has been discussed in workshop of MCI, CISP, that all performance which is going to be there in microbiology needs to be noted down in logbook. Basically, we are going to certify this all important DOP session, or these are the skills which are going to be certified by the teachers of second MBBS in various subjects. Okay, we'll also talk about logbook after this session, maybe next Saturday, where we'll be talking about the microbiology logbook, which are the important sessions to be covered in that. So with that, I complete this session, and this session is open for discussion, right? I think we have got 10 or 15 minutes. We can have some discussion on that. Any questions or any suggestion from you? Dr. Mukesh Kumar would like to. Dr. Mukesh Kumar, you are self-muted. Yes.
Yeah, good evening, sir.
Yes.
Hello. Can you hear, sir?
Yes, yes.
Yeah, sir, one doubt is there. Like just clinical cases are there. If we create our own case history, sometimes what happens that if 3 or 4, 5, 6 faculties are there in the same department, so their authentication of that these symptoms should be there, that signs not to be there. So such a problem comes. So how should we authenticate our case scenario? Because I think it varies from people to people, individual to individual. Sometimes why this is not been asked, why that is not be asked, and sometimes as a junior faculty we cannot resist. So there we face the problem in creating a case scenario, paper case scenario, sir.
You're very
so
right.
how to authenticate that those case scenarios, sir?
See, the best thing is to prepare a simple case, very simple case.
Right, sir.
Like a case of malaria, case of tuberculosis with common sign and symptoms, right?
Right, sir.
There will not be much of a discussion or a debate with regards to that. When
Okay, sir.
we try to take the cases from the journals and other thing, usually these are not the normal case, but they are always
Yes,
rare
yes,
cases with various
yes.
complications. So it becomes very
Right.
difficult. Yes,
Yes, sir.
the first case-based learning session 1 should be very simple. A boy admitted with a fever, chill, rigor, which can directly lead to a clinical diagnosis of malaria.
Yes, sir.
So that will become very easy, and there will not be
Okay.
much of a controversy with regards to that. So my suggestion is that we should always have simple cases with not much of a discussion. But definitely,
Okay, sir.
later on, when you go for another session, you give the cases with complications. It is also
Means that
important to.
distraction should
Yes.
be minimized in the first, and then distraction can be put in the second episode or
Yes.
third episode.
The first
Right.
should be as simple as possible, right?
Right, sir. Right,
Right?
sir. Right, sir.
Immediately they can identify that this is the case of tuberculosis, because that is going to be the
Right.
most common presentation when he is going to go for a clinical practice.
Yes, sir. Yes, sir. Correct.
Dr. Preena Balla.
Good evening, Doctor.
Yeah, good evening, ma'am.
I just wanted to ask, this case-based learning, is it going to be within the 110 hours, which is DOP and small group discussion, or part of the lecture 70 hours?
Yes, madam, this is going to be a small group learning. Case-based learning is always a small group learning. When you are going to take it as a lecture, all lectures should be based on a case, because as for example, today you are going to teach the anthrax, your first slide should be about the clinical case, but you are not spending much time. Hardly you will take 3 or 4 minutes to explain the case, and you come to a diagnosis, and then you go about the clinical features and laboratory diagnosis of anthrax. But if you are planning for a case-based learning, you should plan for some important disease like malaria and tuberculosis. That will be a small group learning, not DOPE. DOPE is only for the skills which you want them to perform, like gram stain, Zn stain, right? Or stool
So
examination.
as part of small group learning, we can do case-based learning and also in lectures. You feel we
Yes.
can do it in both these sessions?
Yes. Lecture, it is not that much authentic, but it will make your lecture interesting, right?
Okay.
And
Okay.
you initiate the topic with that. But remember, all small group discussion which we are talking about in except DOP, small group, that is group discussion, it all will be mostly about the case-based learning. If it is a clinical disease, then it should be case-based learning, right?
Right, sir. Right. Thank you so much.
Thank you, madam. Dr. Nagaraj.
Yes, sir.
Yes, good evening.
Good evening, sir. Sir, we have plenty of things we can actually, case-based learning we can give on anthrax, rabies, and leptospirosis. Many things we can add and make it more interesting to the student, I feel.
Definitely, each and every topic, that depends how much you contribute to your subject, how much you contribute towards the teaching, right? If you start with
Yes, sir.
clinical immunology, you can prepare plenty of things. Yes, sir.
Plenty of things. Yes, sir. I do agree, sir. Thank you,
Yes,
sir.
but definitely you start with the simple one and then you go to complicated one.
Sure, sir.
Yes. Thank you, sir. Dr. Fatima.
Good evening, sir.
Good evening.
Very excellent presentation, sir.
Thank you,
It is
madam.
going to be very helpful for us. My doubt is, sir, if we are going to integrate the case-based scenario during the lecture hour, the usual 60 minutes that is allotted will not be enough, because it will initiate discussion among the students and the faculty who is taking the lecture. So we need extra time. So how we are going to manage?
Madam, see, when you go for a lecture, the purpose is lecture, right? And you need to complete your
Yes.
lecture by 60 minutes, right? Now, any lecture should
Yes.
not last, the content of lecture should not last more than 40 minutes, right? The 20 minutes must be there for a discussion. So you initiate the lecture, you display a simple clinical case, and for 5 minutes, let them discuss that, okay, this is a case of malaria. Remember that before you take a lecture, it is very important that day before your lecture, you release the topic of the lecture. You also release your
Yes.
case which you are going to display. So student will read that case, will read that topic and will come prepared. But remember, you are not going to
Yeah.
discuss in the 160 minutes, you are not going to discuss about the one case. You initiate the discussion and you close it by 10 minutes. And then you talk about the topic which you are going to deliver. That is various other clinical manifestations and laboratory diagnosis. But that is, so the primary focus is your lecture. But if it is a
Oh.
small group learning, You come up with the case, paper case, you hand over them, and then take a full 120-hour session on case-based learning. And you discuss only the clinical case and not about the other things, right? So depending on how we are going to teach them, whether integrated lecture or a small group learning.
Okay, sir. So that means that the topic has to be released one day before, along with like self-directed learning should be there with the student. That will help us to save time.
Definitely every topic has to be conveyed to the students what they are going to be taught in the next coming session, right? Then and then student would come prepared.
Yeah.
Also expect that student should come read, right? So have a habit of asking questions to students that, okay, this was being released to you, and by rotation, so everything, most of the students would come prepared. That is how the case-based learning would be success. Otherwise, it will become very mysterious, and you go on teaching them, right? Then it becomes very difficult. Yes. But when our experience has said that we had conducted this case-based learning. If you want, I can share the details of that, how it was conducted. But definitely, almost all students come very well prepared before the session. Yes, they like it very much. They like much more than your lecture. They would enjoy that. Dr. Kishore. Dr. Kishore, you are self-muted. You can unmute yourself.
Hello.
Yes, yes.
Good evening, sir. Can you hear me, sir?
Yes, yes.
Yeah. It's a very good presentation, sir.
Thank you.
My doubt is not regarding this case-based learning, regarding that teaching learning hours, sir. In the
yes.
Can you just go to that Google Sheet, sir?
Yes.
In the teaching learning hours, sir. Teaching learning hours. Yeah. Yes. Sir.
Yes. 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 Yes.
Sir, here actually, what doubt I had is the total has come like, for example, you can see for the general microbiology and immunology, the total hours was 20.
Yes.
And this also has been added over to come to 73, sir. Which has to not to be there.
Still, I'm not able
so
to.
9 plus 11 plus 20. The 20 also has been added here.
Okay. Okay. Okay.
Even
No.
for the others also.
D5, it is D5, D9, and D15. No, the total is only of this. 20
okay,
plus 20
but the same thing here in SGL, you can just see, sir. It came to 121.
Okay. Right. So this calculation error. Okay.
Yeah. Because it almost went away from the normal MCI hours 110.
Okay.
So I just got it out. So I just wanted to clarify it. Even the others also, you can just have a check later, sir.
Yeah,
I think.
yeah. Surely.
Yes, sir. That is the only doubt.
It is 69. Right.
Yeah.
Okay. Now this 69 is to be multiplied by 2 because it is going to be 2 hours. Right.
Yes.
Yeah. So
I think
by
seeing the hours, we get afraid that almost 110 hours has come out, 120 hours has come out.
Okay. Right. This is total hours are 138. Okay, I'll just have a look at this. What is this? Right?
Yes. Even for SDL and even the other totals also, you can just have a look, sir.
Okay. Now, as we are discussing this, you can see there are something which can be done with respiratory system. There are 14 small groups, so we have to think about that. And in zoonosis, you can see 20 DOP is there. Once again, we'll have to look at that, and 8 SDL. So this yellow in color, once again, we need to work out that how it can be reduced. Right? Yeah. So I think once again we will work on that, and by next weekend we'll be able to come to a comfortable timetable. and then we all need to put it over here like session wise, what we are going to discuss, right? This would be great. Once
Yes,
this
yes.
has been prepared, CVS and blood is remaining, hemoglobin, HbS is remaining. Okay, musculoskeleton, they have come up. CNS is also there. RS is there. GIT, STI is still remaining. And over here, I need the name of the topic, not this one, right? Like this, you can see sinusitis, bacterial crop. This is session that need to be over. So this sheet, when it is ready, it can be compared with this one, right? This will be
Yes.
the total number of lecture, total number of small group learning, total number of top, and self-directed learning. Everything will be there.
I think you can add a column exam also, sir, because we are adding one exam over there.
Yes, yes, yes. We
I
definitely
think
we
in
are going to add it.
teaching learning schedule we have an exam column.
This is what it should be like that. I'll show you our panel which we are doing.
Even the exams also take some hours.
Definitely, definitely. We have already, you can see in this one, teaching hours, weekly, monthly, right? Okay, over here you can see October.
Okay.
Are you able to see? This is vacation.
Yes. Even
So
the holidays are being.
Yeah, first internal exam, second internal exam, everything is there. Yeah, and also if I show you one more thing. The problem is that the 4 department needs to sit together, other 5 departments, microbiology, pathology, pharmacology, PSM, and also community medicine, right? These are the competency. These are our teaching hours, which we are also devising.
Okay.
And this is what we have prepared, complete. You can see immunology, CVS, GIT, right? And you will find exams over here, right? Part ending exam, right?
Okay.
Yeah, it has to be, it has to be there. We are also taking, at the end you will find audio visual quiz, right? So that will, before prelim exam, we organize a quiz. So everything is to be very clear, right? And this is our planner. You can see what we are going to cover in the first semester, second semester, and third semester, right? Everything. So this is how we have to complete our schedule.
Okay.
Definitely, we'll put it over there, right?
Sure.
Okay. Thank you very much.
Thank you. Thank you, sir.
Okay. Any other participant like to ask a question? They can unmute themselves. I don't see any hands raised now. I think all of them have. Okay, so we can have end over here. Tuesday, Dr. Professor of my department, Dr. Kunjan Kikani, will talk about objective structured practical examination and DOPS in microbiology, right? We are not going to discuss theory part of that, but how it can be implemented, because this is going to be implemented for our curriculum, CBME, how we can incorporate in our timetable. So we'll have a discussion on that, and next Saturday we'll talk about logbook also in microbiology. By that time, we'll understand everything and we'll prepare that what is to be added in our logbook. So I think it was a great learning today with a great discussion happening. Once again, see you all guys on Tuesday. So we can now close the session, and I request all of you to please also have a look at the session of Dr. Sheshadri. Right? Okay, so we can close the session today. Goodbye. See you again on Tuesday. Dr. Bedi?
Yes.
I think we can close the session. You
Okay.
can. Once again, we will meet at 7 o'clock.
Yes.
Okay, sir.